Hi friends. Today we are going to discuss a case in which you have a cataract. Along with the cataract, there is a dense vitreous hemorrhage. Why we are discussing this dense vitreous hemorrhage in case when you are doing cataract operation, it doesn't allow any glow to see during the surgery, be it at the initial stage of the capsular axis or once you do phaco chopping and remove the nucleus when we are trying to do IA to remove the cortical matter, you really don't get any glow. So initial part of the cataract surgery you can manage with using the blue and then do Rexis, do hydro, which we normally do with the case with the mature cataract, and that part is can be managed to a certain extent. When you do chop and all those things, even chopping can be managed in these cases when there is a dense vitreous hemorrhage, doesn't allow any glow to happen. But the real problem happens once you remove the nucleus, and once you completely remove the nucleus from the bag, and when you want to do cortical removal. Now in this case you can see the nucleus is removed and the left is cortical removal. Now you don't see any PC here, and then you see a jet black glow. It's because of the dense vitreous hemorrhage, and you really don't know how deep you are going, whether PC is there or not. You can see some cortical matter. It really becomes very difficult for depth of perception. So in this kind of case, I am showing you another case where what we have done is same patient with the similar patient with the NS2, NS3 cataract along with the dense vitreous hemorrhage because of the IPCV. What we have done is, rather than using brilliant blue for staining, we have used chandelier light. Now this chandelier light, the moment you inject or implant in the eye, you will have instant glow. As you see now, there is instant glow coming up, and you don't need to use brilliant blue for Rexis. And once the Rexis is complete, other step of the cataract surgery, hydro dissection, phacoemulsification, it all went very smooth as if the normal case, because there is a constant supply of light because of the chandelier light, and there is a good glow. Glow is the reason why we have depth perception when we are doing phacoemulsification surgery. So chandelier light is very useful tool in this kind of cases. You can see when we are doing phacoemulsification also, you can see the depth, how much phaco tip is going into the nucleus, and it really helps in doing chopping. And once chopping is completed, once you remove the nucleus, even when you are trying to do cortical matter removal, because of the good glow, because of good lighting from the chandelier light, you have a very good depth of perception when you do that. So it is a very simple way of overcoming the problem when you have dense vitreous hemorrhage, just by implanting chandelier light. All the steps goes almost as simple or as normal as if you are doing normal cataract surgery. So I thought it's a useful tool in case when you have dense vitreous hemorrhage. You can definitely try using it. Give me feedback how you feel about it. Thank you very much.